Very warm welcome to everyone joining today's session. Today we'll be diving into an essential part of your FMGE preparation, one-liner questions and previous year questions PYQs in dermatology. As you all know, dermatology is a high-yield subject in FMGE, and mastering these concise clinical questions will boost your accuracy and speed on the exam day. Our goal in this session is to break down key one-liners and PYQs to help you understand not just the what but also the why so you can confidently apply this knowledge in the exam and in clinical practice. Throughout the class, feel free to ask questions and interact actively. We will cover common topics, exam patterns, and provide explanations that will deepen your understanding. So let's get started and make your FMG journey a bit easier and a lot more effective. What is the most common cause of TNF corporis? Trichophyton. Trichophyton. This dermatophyte causes ring-shaped scaly lesions with central clearing, often spread by direct contact. Which condition presents with a malar butterfly rash? Systemic lupus erythematosus (SLE). Systemic lupus erythematosus (SLE). This photosensitive rash across the cheeks and nose is a hallmark of SLE, often with systemic symptoms. What is the primary causative organism for impetigo? Staphylococcus aureus. Staphylococcus aureus. This contagious bacterial infection causes honey-colored crusts, commonly in children. Which skin condition is associated with Koebner's phenomenon? Psoriasis. New psoriatic lesions appear at sites of skin trauma due to this isomorphic response. What is the first-line topical treatment for mild acne vulgaris? Benzoyl peroxide. Benzoyl peroxide. It reduces Propionibacterium acneus and comedones, effective for mild inflammatory acne. Which virus causes herpes zoster? Varicella zoster virus, VZV. Varicella zoster virus, VZV. Reactivation of latent VZV causes painful dermatomal vesicles in adults. What is the hallmark feature of atopic dermatitis? Intense, intense chronic itching leads to eczematous lesions, often starting in childhood. Which condition presents with a hairy patch followed by a rash? Psoriasis rosea. Psoriasis rosea, a large, scaly patch, precedes a Christmas tree patterned exanthem, usually self-limiting. What is the most common trigger for erythema multiforme minor? Herpes simplex virus, HSV. Herpes simplex virus, HSV. Targetoid lesions are characteristic, often linked to HSV infection. Which topical corticosteroid is used for severe eczema? Clobetasol propionate. Clobetasol propionate. This high-potency steroid reduces inflammation in severe eczematous conditions. What is the characteristic histopathological finding in pemphigus vulgaris? Acantholysis. Acantholysis. Loss of keratinocyte adhesion causes intraepidermal blisters and erosions. Which condition presents with a lacy reticular rash on the extremities? Erythema infectiosum. Erythema infectiosum. Parvovirus B19 causes this rash following a slap cheek appearance in children. What is the first-line systemic treatment for severe psoriasis? Methotrexate. Methotrexate. This immunosuppressive agent reduces rapid skin cell turnover in severe cases. Which skin condition is associated with Nikolsky's sign? Pemphigus vulgaris. Pemphigus vulgaris. Rubbing the skin causes epidermal detachment due to fragile blisters. What is the most common cause of allergic contact dermatitis? Nickel. Nickel. This metal in jewelry or clothing triggers localized itchy rashes in sensitized individuals. Which oral antifungal is used for tinea capitis? Griseofulvin. Griseofulvin. It targets dermatophytes in hair follicles, effective for scalp infections. What is the primary autoantibody in bullous pemphigoid? Anti-BPA-TAT. Anti-BPA-TAT. This autoantibody targets hemidesmosomes, causing subepidermal blisters in the elderly. Which condition presents with honey-colored crusts? Impetigo. Impetigo staphylococcal or streptococcal infection causes these characteristic crusts. What is the most common site for basal cell carcinoma? Face. Face. This slow-growing cancer occurs in sun-exposed areas, rarely metastasizing. Which skin condition is associated with Darius sign? Mastocytosis. Mastocytosis. Robbing lesions causes urtication due to mast cell degranulation. What is the treatment of choice for scabies? Permethrin cream. Permethrin cream. This scabicide kills Sarcoptes scabiemites applied to the entire body. Which condition presents with target-shaped lesions? Erythema multiforme. Erythema multiforme. These lesions, often HSV related, have a bullseye appearance. What is the most common cause of tinea versicolor? Malassea furfur. Malassea furfur. This yeast causes hypo or hyperpigmented patches, often on the trunk. Which skin condition is associated with Auspitz sign? Pinpoint bleeding occurs after scale removal due to dilated capillaries. What is the first-line treatment for mild atopic dermatitis? Topical corticosteroids. Topical corticosteroids. Low-potency steroids like hydrocortisone reduce inflammation and itching. Which virus causes molluscum contagiosum? Pox virus. Pox virus. Pearly umbilicated papules are characteristic of this benign infection. What is the characteristic feature of lichen planus? Vicum striavic. Vicum striavic. White, lacy lines on purple papules are diagnostic of this condition. Which condition shows a spaghetti and meatball appearance on KOH prep? Tinea versicolor. Tinea versicolor. Malassezia hyphae and spores are seen under microscopy. What is the most common cause of Stevens-Johnson syndrome? Medications. Medications. Drugs like sulfonamides trigger this severe mucocutaneous reaction. Which condition is associated with the positive T-Zank smear? Herpes simplex virus infection. Herpes simplex virus infection. Multinucleated giant cells are seen in vesicular lesions. What is the primary treatment for actinic keratosis? Cryotherapy. Cryotherapy. Liquid nitrogen destroys precancerous lesions by freezing. Which condition presents with a stuck-on appearance? Seborrheic keratosis. Seborrheic keratosis. These benign warty growths are common in older adults. What is the most common site for melanoma in females? Lower legs. Lower legs. Melanomas often arise in sun-exposed areas with gender-specific patterns. Which skin condition is associated with Gutron's papules? Dermatomyositis. Dermatomyositis. Scaly papules over knuckles are a hallmark of this autoimmune disease. What is the treatment for severe acne vulgaris? Oral isotretinoin. Oral isotretinoin. This retinoid reduces sebum production and prevents scarring. Which condition is characterized by a photosensitive facial rash? Systemic lupus erythematosus. SLE. Systemic lupus erythematosus. SLE. The butterfly rash worsens with sun exposure, often with systemic involvement. What is the most common cause of cellulitis? Streptococcus pyogenes. Streptococcus pyogenes. This bacterial infection causes acute, spreading erythema and one. Which skin condition is associated with a positive pathogen test? Behçet's disease. Behçet's disease. Pistulae formation at needle prick sites indicates this vasculitic condition. What is the first-line treatment for rosacea? Topical metronidazole. Topical metronidazole. It reduces inflammation and papules in this chronic facial condition. Which condition presents with unrular lesions and a trailing scale? Tinea corporis. Tinea corporis. Ringworm lesions have a scaly border caused by dermatophytes. What is the hallmark feature of vitiligo? Depigmented patches. Depigmented patches. Autoimmune destruction of melanocytes causes white patches. Which condition shows linear AG deposition on immunofluorescence? Bullous pemphigoid. Bullous pemphigoid. This autoimmune disorder causes tense bullousy in the elderly. What is the treatment for head lice? Permethrin shampoo. Permethrin shampoo. This neurotoxic agent kills lice applied to the scalp. Which condition is associated with a sandpaper rash? Scarlet fever. Scarlet fever. Streptococcal toxins cause this rough, erythematous rash. What is the most common cause of acute urticaria? Allergic triggers. Allergic triggers. Foods, drugs, or infections trigger transient wheals. What is the treatment for onychomycosis? Oral terpenafine. Oral terpenafine. This antifungal targets fungal nail infections effectively. Which condition presents with the dewdrop on rose petal appearance? Chickenpox. Varicella chickenpox. Vesicles on an erythematous base are characteristic of this viral infection. What is the most common cause of drug-induced photosensitivity? Tetracyclines. Tetracyclines. These drugs increase UV sensitivity, causing erythematous rashes. Which condition is associated with a positive cross sign? Neurofibromatosis type 1. Neurofibromatosis type 1. Axillary freckling is a diagnostic feature of this genetic condition. That's all for today. See you in the next class.